Now, under pharmacology, we have different types of drugs, and each drug is actually classified under what it actually specifies, or based on its mode of mechanism and action. Now, we can start with the most profound and the most permeated types of drugs, which are the antibiotics. Now, under antibiotics, it's classified differently because each antibiotic form falls under its own specific subclass. Now, the first class of drugs, we always call them the class of drugs, it's called the beta-lactamers. And the reason why it's called the beta-lactamers is because it acts on the cell wall of the bacteria. Now, remember, bacteria, it's an organism, and the way the bacteria get attenuated, or rather the way the bacteria get removed from the body or attacked by antibiotic, each antibiotics will specify on its mechanism on how it's going to attack, and based on its mechanism, it's how you're going to classify it. This, because beta-lactamers, as I've told you, these are the antibiotics that they attack the cell wall of the bacteria. Now, under the beta-lactamers, we have the most profound ones, which are the penicillins. Under penicillins, it has 3 dichotomers. One, it's the simple penicillins. Now, under simple penicillin, we have there are actually two types of drugs. One is benzyl penicillin and phenylmethyl penicillin. That is under simple penicillin. And we have, let's say, we have drugs that form under resistance bacteria antibiotics. Now, these antibiotics will be prescribed to indication, or rather to patients who has bacteria that has a higher level of resistance. And this is where we give oxycillin. Another type of penicillin, we call it aminophene amoxicillin. This is under over-the-counter the drugs, we call them amoxicillin or amoxin, but we, the medics, we call it the amoxicillin, aminophene amoxicillin, right? Now, let's leave under penicillin. We have ciprofloxacins. We have monobactamers. See, they all fall on beta-lactamers. The penicillin, the ciprofloxacin, the monobactamers, and the last one, carbapenems. Now, carbapenems, these are very high resistance antibiotics, and the most profound one is meropenem. That's why patients who come with severe pneumonia, these are the kind of drugs we administer them. Patients who present with bacteremia, or the levels of infection in their blood is actually higher, they will need a higher form of antibiotic to counteract that specific bacteria. Now, let's leave the class of beta-lactams. We have different types of antibiotics. We have another classification of antibiotics, we call them aminoglycosides. And then we have macrolides. We also have fluoroquinones, the last one, tetracycline. All these are types of antibiotics, and you have to be conversant with them. And the reason why I decided to talk about antibiotics is because they're very profound, and these are the drugs that are this is actually the first type of the first types of drugs that you actually introduce to any patient, because in any sickness, bacteria is well permeated, is well distinguished, and we have to deal with it because of infection control. And that is like the main reason why I've decided first we talk about the antibiotics. If we understand the types of antibiotics, then we shall have an easy time on transversing and this type of, like, if we in these types of other types of drugs, like anti-helminths, these are the albendazole that controls, that they fight any form of worms in your body. You also have the antiemetics that are there to help counteract the nausea, the vomiting. And antiemetics, we have different types of drugs. We have serotonin uptakes inhibitors, we have dopamine antagonists, we have corticosteroids, we have anticholinergics, so they all fall under antiemetics. And the reason why they will fall under antiemetics is because they slow down the GIT motility, so thus reducing the muscle contraction. Nausea and vomiting comes because of that, volatility of your motility of your intestines and the muscles. And that's why you feel the discomfort, you feel this abnormality of movement. That's what it creates the nausea, and finally can inflict to vomiting.